The buzz around testosterone therapy for aging men just keeps going, doesn't it?
He really does.
You hear these stories, maybe it reverses aging, gives you energy.
Yeah.
But then you also hear about serious health risks.
Yeah. It's confusing. Hard to know what's what.
Totally. So for this deep dive, we're really going to zero in on the science.
Mm-hmm.
Our goal, pretty simple. Let's dissect the latest research, give you a clear picture, the real evidence for and against TT.
Right. We pulled together some key studies.
Yeah, a really compelling set. We'll walk through them, try to make sense of this whole debate.
Absolutely. And just to be clear, our aim isn't to push you one way or the other.
No, not at all.
It's about giving you an objective, evidence-based look at what the science is actually saying right now.
Exactly. So we've got 6 key publications we're going to look at. These really represent the cutting edge here.
Let's lay them out.
Okay, first up. Testosterone therapy in older men. Clinical implications of recent landmark trials. That's by Grossman, Anawalt, and Yep, from 2024 European Journal of Endocrinology.
Right, a big review.
Yeah, it looked at 4 major trials, found TT helped with sexual function, bone density, lean body mass.
Importantly,
yeah, no consistent increase in heart problems or prostate cancer over 1 to 3 years.
And that diabetes point.
Oh, right.
Yeah.
One trial they looked at showed a huge, 41% drop in progression to type 2 diabetes. Pretty interesting.
Which brings us neatly to the next one. That specific trial was called T4DM.
Ah, yes.
The full title is Testosterone Treatment to Prevent or Revert Type 2 Diabetes in Men Enrolled in a Lifestyle Program. T4DM. It's a long one. A randomized, double-blind, placebo-controlled trial. Wittert and colleagues, 2021, Lancet Diabetes and Endocrinology.
Okay, so the T4DM study itself.
Exactly. It confirmed that 41% reduction over 2 years. This was in men with low testosterone, hypogonadal men who had pre-diabetes or early diabetes.
And other benefits, too.
Yeah, they also reported better sexual function, more muscle mass, and improved quality of life overall.
Okay, good context. Next,
we've got one focusing on obesity. Effects of testosterone therapy on body composition and sexual function in men with obesity and low testosterone. Fouy, Hormone, and Grossman, 2022, in Clinical Endocrinology.
So specific group there, obese men, low T.
Right. And over 2 years, TT increased their lean body mass, cut down fat mass, and helped with sexual function.
And cardiovascular.
Again, no significant jump in cardiovascular events reported on that one.
Okay, seems positive so far.
Yeah.
There's another side, right?
Definitely. Now for a more cautious take. Testosterone replacement in aging men. An evidence-based, patient-centric perspective. Boston and others. Journal of Clinical Investigation, 2021.
Patient-centric perspective sounds important. What's their angle?
They basically pump the brakes.
Yeah.
Argue against routine TT. They say the benefits for things like depression, thinking skills, or even physical function, they're often limited. Maybe not much better than a placebo.
And risks.
Yeah, they highlight potential risks, like increased fracture rates, possibly speeding up prostate cancer. They really push for super strict criteria for who should even consider TTH.
Got it. Adds a layer of caution. What else?
Adding to that conscious view, there's testosterone replacement therapy and cardiovascular risk. This is a systematic review by Galeano-Jucá and Passaria from Nature Reviews Cardiology in 2020.
Okay, focused on the heart. What did they find?
Well, it's kind of mixed, actually. Some trials.
Yeah.
No increased risk of major heart events, heart attacks, strokes.
But others?
Others showed worrying signs, like increased plaque buildup in arteries, other risk markers going up.
So not a clear picture on safety then?
Not entirely clear, no. Their advice, don't use TT unless someone has clear hypogonadism, especially if they're older or have other health issues.
Makes sense. Okay, one more study. Yeah.
Yep. The last one zeroes in on prostate cancer, testosterone therapy and prostate cancer risk, and updated meta-analysis. Loeb and colleagues, European Urology Focus, 2023.
A meta-analysis, so combining results from multiple trials.
Exactly. 11 randomized controlled trials. The gold standard, really.
And the finding?
Short term, so 3 years or less. No significant increase in overall prostate cancer cases.
Okay, that sounds reassuring.
Well, yes and no. PSA levels, that prostate marker, did go up significantly in the TT groups. And maybe, just maybe, a slight increase in higher grade, more aggressive cancers. It wasn't statistically significant, but it was there.
So short-term, okay-ish, but long-term.
Long-term risk.
Yeah.
Still a big question mark, they emphasize.
Wow. So quite a range of findings there. We've got studies showing benefit sexual health, metabolism, body composition.
Right.
And then others raising these serious red flags. Limited effectiveness for some stuff, potential heart risks, prostate concerns.
It really paints a picture of why experts are so divided on this, doesn't it?
Absolutely. You can almost picture a room full of specialists arguing about this data.
You really can.
Yeah.
Let's maybe try and unpack some of those core arguments, those points where they really disagree.
Good idea. Let's start with those more general aging complaints. Feeling tired, low energy, maybe a bit down. Does teeth actually help with that stuff?
That's definitely a major point of contention. The pro-teethy side, let's call them that.
Okay.
They'll point to studies like the ones Grossman reviewed in 2024. Those trials did show some, well, modest, but statistically significant improvements in vitality, maybe mood, in older guys with confirmed low T.
Modest, okay.
And they'll bring up the FUI study from 2022, again, increases in lean mass, grip strength. The argument is, look, for some men, these changes feel real. They feel re-energized, and maybe lifestyle changes alone didn't cut it for them.
Right. But the other side pushes back hard on that, I imagine.
Oh, absolutely. The more cautious camp, drawing on Boston's 2021 review, they say, hang on, these improvements, they're often minimal, barely better than placebo in many cases.
Right. The placebo effect is powerful.
Exactly. And they point out that objective measures, like how far someone can walk in 6 minutes, often don't really improve much.
So subjective feeling versus objective function.
Kind of. Their worry is using TT for these vague symptoms, risks, medicalizing normal aging, especially when you have safer options, exercise, maybe therapy.
And the muscle gain.
They question if a little extra lean mass matters if it doesn't translate to better function. Is it clinically significant? And yeah, is that feeling of energy just wishful thinking or placebo?
So it boils down to what's a real improvement, and are subjective feelings enough to justify hormone therapy over other options?
That's the core tension right there.
Right.
Okay, let's shift gears. Cardiovascular safety. This has been a shadow hanging over TT for ages. What's the latest?
Right. Well, the pro-TT side feels a bit more confident now, maybe. They often highlight recent big trials. Grossman's review mentioned the TRAVERSE trial.
Yes, a big one.
Yeah, over about 3 years, it didn't show more major heart attacks or strokes. That's significant.
MAZ, major adverse cardiovascular events.
Right, MEE, no increase. And then there's that T4DM trial Wittert did in 2021, lowering diabetes risk. That's got to be good for the heart indirectly, right?
You'd think so.
So the argument is, pick the right patients, guys, with proven low T, no advanced heart disease, monitor them carefully. And it seems pretty safe based on this newer data. Safer than older studies suggested, maybe.
Okay, but the cautious side isn't fully convinced, even by TRAVERSE?
Not entirely. Galeano-Juchat and Vasaria's 2020 review really digs into this. They say, okay, maybe MACI didn't go up in TRAVERSE, but other things did. Subclinical markers like non-calcified plaque volume in the coronary arteries went up. Hematocrit went up.
So things you wouldn't necessarily feel, but could signal future trouble.
Exactly. Maybe not immediate heart attacks, but are we setting people up for problems down the road? Especially older guys with existing issues?
And they also point out who was in those trials, right?
Yeah. TRAVERSE excluded men who'd had a recent heart attack. So can you really apply those findings to everyone you see in the clinic? Maybe not.
And the T4DM diabetes benefit.
The skeptics wonder, was it the testosterone or was it the intensive lifestyle program everyone in that study got? Hard to untangle.
So they want more time, longer studies.
Definitely. They argue this short-term safety data just isn't enough, especially when you see these underlying markers shifting. How do you weigh that against no immediate AMCE increase? It's tough.
So again, disagreement on how much evidence is enough and how to interpret these different signals, clinical events versus subclinical markers, especially in older, potentially sicker men.
Precisely, which leads us naturally to the other big worry, prostate cancer, another long-standing concern.
Huge one. What's the current thinking there?
Well, the pro-TT folks again point to recent data as being, well, largely reassuring.
Like TRAVERSE again?
Yeah, Grossman's review notes TRAVERSE found no significant increase in prostate cancer cases, and that Loeb meta-analysis from 2023, the odds ratio is basically 1.0, meaning like no real change in risk overall short term.
So pretty neutral. Pretty
neutral overall. They admit PSA levels often go up a bit, but usually stay within acceptable ranges. They tend to think the old feels about T causing cancer were maybe overblown.
Okay, makes sense. But the cautious camp must have counterpoints.
Oh, for sure. They look at that same low meta-analysis and say, hold on, okay, overall risk wasn't significantly up short term, but They saw that trend towards more high-grade cancers. Maybe not statistically significant, but worrying, right? More aggressive cancer.
Yeah, you'd want to ignore that.
And the PSA rise, even if it stays in range, it definitely causes more anxiety, more biopsies, more diagnostic uncertainty for patients and doctors.
Sure.
Plus, Boston's 2021 review brings up a crucial point: duration. Trials like TRAVERSE, maybe 3 years. Is that long enough?
Probably not to catch cancers that take years to develop or progress.
Exactly. Especially if TT might be stimulating some slow-growing, undetected cancer that was already there, a latent tumor.
That's the fear, isn't it? That you're pouring fuel on a hidden fire.
Right, and we just don't have the 10-year, 15-year data to know for sure. So the cautious advice is be really careful, especially if a man already has a high PSA or other risk factors. Screen carefully, monitor closely.
So it's that short-term versus long-term uncertainty again. Is the current data sufficient, or are we missing potential serious harm down the line?
That seems to be the crux of the prostate debate. Okay, so summarizing this whole expert back and forth, it feels like one side is really focused on the patient experience now.
Yeah, the pro-TT view emphasizes those quality of life benefits, sexual function, maybe energy, metabolic health in men who definitely have low T, and they feel reassured by the recent trial data on short to medium-term safety if patients are chosen carefully and watched closely.
Right. While the other side, they're looking further down the road.
Exactly. The more cautious experts prioritize those potential long-term risks, heart, prostate, maybe even fractures like Boston mentioned. They question if the benefits, especially for those vaguer symptoms, are really strong enough to outweigh those unknowns.
So they advocate for using it much less often?
Generally, yes. Reserve it for clear, symptomatic hypogonadism where other things haven't worked. But interestingly, both sides would probably agree we need more long-term data
Yeah, that seems universal.
and better ways to figure out who specifically will benefit and who's at higher risk.
Yeah.
But they definitely disagree on what doctors should be doing today based on what we know now.
Okay. So for you listening, trying to make sense of all this, what's the bottom line here? What's the most important takeaway from this deep dive?
I think the most critical point, really, is that deciding about testosterone therapy, it's super complex and incredibly individual.
No easy answer.
No simple yes or no. It absolutely requires a really careful weighing of the potential benefits, which, as we heard, can be real for some guys in certain areas.
Sexual function, maybe metabolic.
Right. Balanced against those potential risks, which, yeah, might look low short-term in some studies, but long-term picture, still fuzzy.
And it all depends on the individual.
Totally. Your specific health, your symptoms, your own risk factors, it all has to go into the mix.
So talking to your doctor isn't just recommended, it's essential.
Absolutely essential. There's no substitute. You need to sit down, discuss these findings, your entire medical history, any worries you have. Talk to a healthcare provider who really knows this area.
They can help figure out that personal risk-benefit balance.
Exactly. Help you make an informed choice that's actually right for you.
Wow. This has definitely been quite the deep dive. Really highlights how complex and, frankly, how much this area of men's health is still evolving.
It really does.
Yeah.
Our understanding of testosterone and aging, it's clearly still a work in progress. We need that ongoing research.
Yeah. And it makes you think, too, what does quality of life really mean as we get older?
That's a great question.
And how do different things, hormones, exercise, diet, mental health, how do they all play into that? It seems this conversation is far from over.
Not by a long shot.